Rainy season, beware of 6 diseases that can affect children. Even though it's fun, playing in the rain is not recommended for children because of the bad effects, especially when there is a flood. Not only causing natural disasters, floods are also a medium for the spread of various diseases. Here are some diseases that can be transmitted through contaminated water and environmental hygiene that can worsen due to rain or flooding. 1. Dengue. Stagnant water can be a breeding ground for mosquitoes and potentially increases exposure to dengue infection. Dengue virus infection is a common disease that affects both children and adults in the rainy season, occurring in tropical areas. Symptoms of dengue fever include rash, high fever, and others. Apply 3M+ to eradicate mosquito nests and avoid their bites. 2. Fungal infection. Since the skin is moist and wet all the time, the possibility of developing a yeast infection is quite high. The skin must be kept dry at all times. Ask the children to dry off after coming home. Fungus often breeds when the skin is moist and not exposed to air. 3. Gastrointestinal infections. Poor sewage systems, improper hygiene, overcrowding, and unhealthy consumption of water during floods contribute to gastrointestinal infections. To avoid infection from contaminated food and water, ask children to drink clean and cooked food and eat healthy food. 4. Leptospirosis. This disease is transmitted through skin or mucous membrane contact with soil, mud, or water contaminated with the urine of rodents infected with leptospira bacteria. Even if they have minor cuts on their feet, they should be careful not to get into contaminated water. 5. Conjunctivitis. Infection of the eye which is characterized by pain, red eyes, not strong light, watery, can be accompanied by dirt and stickiness. This infection is easily transmitted, so keep those who are sick away. Don't share towels and other items, and wash your hands often to reduce the transmission of typhoid or typhoid fever. 6. Hepatitis A. Hepatitis A is also a disease that is transmitted through water contaminated with the hepatitis A virus with symptoms such as fever, diarrhea, nausea, weakness, and yellow discoloration of the skin and eyes. Thus a brief explanation of the diseases that attack children during the rainy season. Hopefully this show